Bismillahirrahmanirrahim. Assalamu alaikum, dear students. I welcome you all to today's lecture, which is dose-response relationship. And I'm Dr. Neelofar Warraich, Assistant Professor, Department of Pharmacology, to demonstrate you about today's lecture, which is dose-response relationship. So, learning objectives of our today's lecture are, by the end of the lecture, you people should know about what is actually dose-response relationship, what are dose response curves, what are various types of dose response curves, how they are plotted, and what information can be depicted by dose response curves. Here, I want to add that it is one of the very important university questions, especially types of DRC and what is the difference between types of DRC. मैं अभी टाइप्स नहीं बता रही, आगे जाके बताऊंगी, and what information actually we can depict or we get from DRC's dose response curves. ठीक है? So what is actually DRC, dose response curve? It is the relationship between drug concentration and response. We are administrating a specific dose to a patient. After administration, we want to get a therapeutic response. So this relationship is DRC. ठीक है? हमने मेडिसिन दी है, फॉर एग्जाम्पल एंटीपायरेटिक दी एस्पेनाडोल. अब उससे हमें एंटीपायरेटिक रिस्पॉन्स मिलता है कि नहीं, किस डोज पे मिलता है? 0 मिलीग्राम पे मिला, ऑफ कोर्स देयर इज नो ड्रग. 1 पे मिला, 2 पे मिला, 5 पे मिला. तो ये सारा हम डिपिक्ट करेंगे. कैसे ये इंफॉर्मेशन मिलेगी? डोज रिस्पॉन्स कर्व से. It is a complex method as observed clinically in patients, but simple in carefully controlled in vitro systems. It can be described mathematically and represented graphically. Let's see how we can do all of this. So, what is actually definition of dose response curve or concentration effect curve? A graph between dose and response produced by the drug using an in vitro in vivo biological system. Dose is plotted along x-axis, whereas response is plotted along y-axis. There are two types of dose response curves. One is graded DRC and the other one is quantile DRC. Here the question arises, what is the difference between graded dose response curve and what is quantile dose response curve? This is one of the important university question, noted down. So, what is graded dose response curve? It is a quantitative curve between increasing doses, concentration of drug, and varying responses. Of course, meaning is reflected from the word graded. As we increase the dose, we get different magnitude of response. जो अभी मैंने एग्जाम्पल दी, 5 मिलीग्राम पे और इफेक्ट आएगा, 10 मिलीग्राम पे और आएगा, 15 पे और आएगा. ग्रेडेड फॉर्म में हमने डोज देनी शुरू की और हमें उसका रिस्पॉन्स अकॉर्डिंगली आना शुरू हुआ. तो दिस इज कॉल्ड ग्रेडेड डोज रिस्पॉन्स कर्व. Repeating again, it is a quantitative curve between increasing doses, concentration of drug, and varying response. From dose response curve, we get to know about threshold dose. What is threshold dose? It is that specific point or dose concentration of drug at which we start getting the therapeutic effect. We cannot say that it is our desired, required therapeutic effect, but this is where the drug starts working. Okay, जी? And from this DRC, from graded dose response curve, we also get to know about dose producing maximum ceiling effect. ठीक है जी, कहाँ से effect आना शुरू हुआ और कहाँ तक जाएगा? मैक्सिमम अपना लेगा इफेक्ट. उसके बाद क्या होगा? सारे रिसेप्टर्स ऑक्यूपाई हो जाएंगे. जितनी मर्जी हम डोज इंक्रीज कर लेंगे, बट it will fail to get any further response or any further effect. So that would be our ceiling effect or dose producing maximum effect. You can see that at 0.5, we start getting the response. By the passage of time, as we started increasing the dose, we get a higher magnitude of response. But at 64 milligram, you can see that it was the maximum response we can attain. After after increasing the magnitude or increasing the dose, magnitude or response is not changed. That means this is the maximum ceiling effect we have got, and further it we're not going to get any other response or any further potential effect. So the relation between concentration and effect can be described mathematically. E is equal to E max into C by C by EC50, where effect observed. What we are observing? Of course, the drug's effect after giving a specific dose. Concentration of the drug, the maximum response produced by the drug, and the EC50 is the concentration of drug that produces 50% of the maximum effect. Okay. Now, effect is mathematically calculated by maximum response into concentration of the drug divided by concentration into 50% of response. The concentration of drug that from which we get 50% of maximum response. And it can be represented graphically in the form of hyperbola curve. If we say that if the percentage of receptors that bind drug is plotted against drug concentration, a similar curve is obtained, that is hyperbola curve, because the response is due to binding to receptors. In the start, I said that maximum effect पे क्या होता है, सारे रिसेप्टर्स बाइंड हो जाते हैं, कोई रिसेप्टर नहीं रहता, इसलिए अगर हम डोज चेंज इंक्रीज भी करते हैं तो हमें फर्दर रिस्पॉन्स नहीं मिलेगा, फर्दर मैग्नीट्यूड ऑफ रिस्पॉन्स नहीं मिलेगा. सो if we consider EX instead of effect, we take the bound receptors, we can see that maximum number of bound receptors into concentration of drug over concentration of drug plus Kd, whereas Kd is that binds 50% of the receptors in the system, whereas Bmax is the maximum number of bound receptors. Here, look at this. It is the maximum effect we are getting, and EC is the 50% of the maximum receptor at the dose at which we are getting 50% of the maximum effect. Whereas same thing is converted into logarithm and we have got the sigmoidal graph. Here it is hyperbola. See the shape. This is hyperbola. Whereas this is sigmoidal in the form of C. And 5 is same as we have getting it is the dose at which we get 50% of the maximum response. In case we look at if we are talking about that a drug is mimicking an agonist in vitro or in biological system, we must say that agonist go in the body and binds to the receptor. If we consider drug as an agonist and it is going to bind the receptor in the body, we can talk about the maximum bound receptors. So effect is Kd is the 50% of bound receptors. Look at this, 5 पे भी EC50 था, Kd पे भी 5 में, यहाँ पे भी 5 पे भी Kd आ रहा है, ठीक है. क्या हो रहा है? We are checking a group of people. उसमें हमें ज़्यादा स्पेस मिल जाती है. एक में इफेक्ट आ रहा है, थोड़ा आ रहा है, ज़्यादा आ रहा है. We get a wide area to play with, a lot of number of patients or subjects to play with to get to know about the effect. Here we sorry over here in simple hyperpolar curve we are only discussing a single subject. So let's see. Advantages of semi-log dose response curve is sigmoid in shape with no linear mid portion, so it occupies less space. Many observations can be recorded on same graph paper. This shape expands the scale of dose axis at low concentration, where the effect is changing rapidly, and compresses is at high concentration, where the effect is changing slowly. Comparison of two curves becomes easier. If we are comparing two more drugs, we can compare them on a same graph on a same paper. It is used for determination of the potency. Potency की definition you people have done, and let's see what is potency. Potency is the if desired effect we are getting of the drug. Determination of the maximum efficacy. Efficacy is how efficiently it is getting, it is performing its therapeutic effect. Determination of selectivity of effect. Receptor study, drug antagonism. By this drug, we can know about the agonist response and antagonism response. Determination of biological variations. Let's see how. Here is an example of four drugs A, D, B, and C, and you can see how we are getting on the same page we are seeing comparing the effect of more than one drug on the same page, and we get to know which is more potent and which is more efficient drug over here. So drug B is less potent but equally efficacious as drug A. Look at this. We are getting response here, whereas drug B is getting response over here. So potency is very, very important. Okay? In clinical practice, we have to look at the efficacy and potency both. A drug which is potent have started giving effect at 0.5 milligram, and other drug which is giving its effect at 1 milligram. So we will say that drug giving effect at low dose, that is 0.5 milligram, is more potent. So drug A is more potent than B. But what we see, maximum effect of both drugs are same. So they are of equal efficacy but different potency, and A is more potent. Similarly, drug D is more potent than B, but D is less efficacious than B. I hope you are getting my point. So, drug C is less potent and less efficacious than drug A, but equally potent and less efficacious than drug B. Drug D is more potent than drugs A, B, and C, but less efficacious than drugs A and B, and equally efficacious as C. So here we can see for different responses for different receptors, we have plotted the drug, and we can see that how different drugs are acting for their specific functions, and we are getting the response. So here comes the effect. How we are getting at minimal therapeutic effect we are getting, and this is the therapeutic effect. In the same way, we can administer, we can observe their adverse effects too. At what dose we start getting the adverse effects, minimum adverse effects, and then unacceptable adverse effect. Okay, let's say this thing in simple words. There is a drug at, for example, we are getting at 3 milligram it's a minimal therapeutic effect, but as we increase the dose to 3 to 10, we are getting its therapeutic effect. But as we raise the dose from 10 milligram, we are starting getting its adverse effect. So some adverse effects are tolerable, but some are not. So we have to stop that drug over there. So क्या होता है जी, 5 मिलीग्राम पे हमें उसका एडवर्स इफेक्ट मिलना शुरू होता है, टॉलरेबल, 6 पे टॉलरेबल, 7 पे टॉलरेबल, बट once it have achieved the 10 milligram, after that its adverse effect is not tolerable and we have to stop or minimize the dose over there. इस चीज का भी हमें कहाँ से पता चल रहा है? डोज रिस्पॉन्स कर्व से. So as we talked in the beginning of the lecture, that dose response curve से हमें क्या information मिल रही है? We can talk about, we can we can compare things as agonist and antagonism. Drug antagonism का phenomena भी इसमें है. कैसे? Let's see. We are considering a drug A as the main drug and it is acting as agonist, and we are getting the response at less than 0.1 dose. ठीक है जी, and we are getting its maximum response over here. But when we add a competitive antagonist, antagonist क्या है? जो काम रोक देगा, ब्लॉक कर देगा. इसके example we can say like there is a lock hole and you are putting the wrong key in it. So what will happen? The door will not open. In case of agonist, it is the perfect key for it. But in case of antagonist, what will happen? The door will get jammed, the lock will get jammed, it will not open, and it will not even allow any other key to be put inside to get open. सही है, ये agonist antagonist होता है. अब competitive antagonist क्या होता है? There is a टाइम के रिसेप्टर्स पे वो कॉम्पिटेटिवली करेगा. अगर आप रिसेप्टर साइड बढ़ा दोगे, एगोनिस्ट बढ़ा दोगे, तो वो खत्म हो जाएगा और वो अपना एक्शन दे देगा. दिस इज कॉम्पिटेटिव एंटागनिज्म. वेयर एज नॉन कॉम्पिटेटिव एंटागनिज्म में क्या होता है कि वो जगह मल लेता है, चाहे जो मर्जी करो वो जगह नहीं छोड़ेगा. ठीक है, लेट्स सी. In presence of agonist and competitive antagonist, we have got threshold doses increase, but we are getting the response. But in case of non-competitive antagonist, a lot of a lot of dose is required to reverse it or to overcome it. So this is how we are comparing the effects. Alone as agonist, in the presence of competitive antagonist, and in the presence of non-competitive antagonist. In the same way, when we change the values in logarithm and we can see a large group of number subjects, observe a large number of observations, so we put the thing in log doses, and this is how we get the sigmoidal shape. Same, वो sigmoidal shape में दिखाया था. अब same effect is in the form of what? In the form of hyperbola. Let's see, agonist alone is getting this effect. Agonist plus competitive antagonist is getting this effect. Look at this. How gradually it is increasing and getting flattened. After maximum effect, however we increase the dose, we do not get increased magnitude of effect. In picture B, you can see that in the presence of irreversible antagonist or non-competitive antagonist, the curve is very much lower than agonist alone. So this, we can see that we are not getting the required therapeutic effect or more therapeutic effect in presence of antagonist. So here, agonist alone is more potent in getting maximum efficacy in comparison to agonist in the presence of competitive antagonist. In the same way, in the presence of irreversible antagonist, agonist is more potent and efficient. So let's see effect of drug concentration on receptor binding. The quantitative relationship between drug concentration and receptor occupancy applies the law of mass. Simply, we are considering drug as agonist and it have to go and bind to a receptor side where it will do its intrinsic activity or for what desired therapeutic response it is taken, it will give that therapeutic effect. So if we consider it as law of mass action to the kinetics of the binding of drug and receptor molecules, we can say that drug plus receptor is continuously in an irreversible process. Drug receptors complexes are being made and detached, and they are resulting into various biological responses. In last slide, we have seen the effect relationship. Now we are taking effect as receptor occupancy, and we are applying this law of mass on it. Let's read the slide. The quantitative relationship between drug concentration and receptor occupancy applies the law of mass action to the kinetics of the binding of drug and receptor molecules. If we see that drug receptor and drug response, a biological response, let's see what happens. Over here, you can see that we are looking for the affinity of a drug for its receptor, and we are they're looking for the free drug present in the system and drug bound to the receptor and total number of receptors. So the value of Kd can be used to determine the affinity of a drug for its receptors. Affinity describes the strength of the interaction, how strong the bond or interaction for the intrinsic activity is present over there, how strongly a drug or agonist is attracted to its receptor, how much they will bind and produce the biological response. As in the previous one of the previous slides, we have seen that once drug and receptor are attached with each other in the form of drug receptor complex, it finally produces biological response action. So repeating it, affinity describes the strength of the interaction between a ligand agonist drug and its receptor. The higher the Kd value, the weaker the interaction, the lower the affinity, and vice versa. Kaise? If Kd value is small, that is, the receptor have a high affinity for its ligand, it will attach fastly and give the therapeutic response. For example, we are getting a Kd at 0.1 milligram, but for a drug, Kd for another drug, Kd is 0.5 milligram. That is, we have increased the dose. So this thing is proof over here, a proof that the higher the Kd value, the weaker the interaction. It will take more time to get to interact, to take place the interaction between ligand and its receptors. So the lower the affinity and vice versa. Here C. As the concentration of free drug increases, the ratio of the concentration of bound receptors to total receptor approaches unity, thereby producing the maximal effect. If we see that free drug is increased in vitro system, that means all of the receptors are bounded. There are no more receptors to give any intrinsic activity or biological response. That is very good thing. ठीक है? And we have attained the maximum amount of magnitude of our response. Increasing the dose, giving sulfurous dose in the body is of no use now. We have got what was needed. So let's see. Bound receptors over total receptors. we have get from threshold effect, we have got the therapeutic effect and maximum effect. And same thing where we have converted into log a logarithm, so we are getting the sigmoidal curve. So I'm repeating this thing: as the concentration of free drug increases in the system, the ratio of the concentration of bound receptors to total receptors approaches unity, thereby producing the maximum effect. So now let's see that was we have discussed the drug receptor response. Drug is coming in a form of ligand, agonist, and occupying the receptor, and what effect is going in biological system. Let's see what is the relationship of drug binding to for a specific pharmacological effect. Sorry. The law of mass action can be applied to drug concentration and response providing the following assumptions are met. If we consider the magnitude of the response is proportional to the amount of receptors occupied by the drug, same thing is being repeated. The Emax maximum effect occurs when all receptors are bound, same thing. And one molecule of drug binds to only one molecule of receptor. In this case, क्या होगा? E is the effect over maximum effect into concentration of drug divided by Kd plus concentration of drug. So, thus it follows that if a specific population of receptors is vital for mediating a physiological effect, the affinity of an agonist for binding to those receptors should be related to the potency of the drug for causing that physiological effect. In simple words, I can say that if we are taking a specific population of receptors for a specific purpose or for a specific what I want to say is for a specific effect, we can say that the drug we are administering should be enough potent to produce that effect. Okay? Many drugs and most neurotransmitters can bind to more than one type of receptor, thereby causing both desired therapeutic effects and undesired adverse effects. So, if we are giving or administrating a drug, we should be considering its therapeutic desirable effects in comparison to undesired effects. So the drug should be potent enough to give that therapeutic effect. In order to establish a relationship between drug occupation of a particular receptor subtype and the corresponding biological response to that drug, correlation curves of receptor affinity and drug potency are often constructed. For this purpose, we construct more than one drug. We see the receptor's therapeutic effects on a specific receptor and the other effects which are not needed but still they will be occurred or we will face them. We see plot another graph for it to see what other effects can be depicted or can be established from it. So it it is all game of actually intrinsic activity. A ligand, uh, an agonist, or a drug. Whenever binds to a receptor, we'll see look for the intrinsic activity. So, an agonist binds to a receptor and produces a biological response based on the concentration of the agonist. That means potency. Agonist in such amount that it can produce the biological therapeutic effect. That is its potency. Its affinity for the receptor and hence the fraction of occupied receptors. However, the intrinsic activity of a drug further determines its ability to fully or partially activate the receptors. Drugs may be categorized according to their intrinsic activity and resulting Emax values. So we'll categorize drugs according to their intrinsic activity and how much they can produce the maximum effect. So what is agonist? Agonist is affinity and efficacy. Intrinsic activity is equal to 1. That means it has affinity. It will what? It will occupy the receptor site. And after occupying, it will give its therapeutic effect, that is intrinsic activity. So maximum possible response, which binds to a receptor and produces a response resembling to endogenous substances. Here it is, लॉक एंड की मैकेनिज्म होता है. एगोनिस्ट आया, रिसेप्टर पे लगा, इंटरेक्शन हुआ और इंट्रिंसिक एक्टिविटी हुई, बायोलॉजिकल सिस्टम में चेंज हुआ, बॉडी को पता चला कि कुछ हो रहा है. We can say it is a perfect for full agonist we can say it is a perfect fit. Partial agonist क्या होता है? Drug is said to be a partial agonist when it binds to a receptor and causes a submaximal efficacy. That is partial response आएगा मगर वो नहीं आएगा जो हमें required है. It would be less than desired, less than 1. Antagonist has affinity but no efficacy. Sorry. It is not potent, it is not efficient even to produce an effect. So a drug is said to be an antagonist when it binds to a receptor and prevents a natural compound or a drug to have an effect on the receptor. Its intrinsic activity is zero. An antagonist has no activity. So let's see, there is an antagonist receptor comes, fits over here, and antagonist receptor complex takes place, and it will not allow normal receptor or normal ligand to bound over and give its response. So here what we get on then on graph, that full agonist is giving its maximum Emax, maximum effect, maximum efficacy. What is happening that we are getting full agonist is most potent and most efficacious drug. ठीक है, वो कम डोज पे अपना थ्रेशोल्ड डोज दे रही है, वो कम डोज पे थेरेप्यूटिक इफेक्ट देते देते मैक्सिमम इफेक्ट दे रही है. Whereas partial agonist is less potent and less efficacious than full agonist, but still it is giving some effect. But what a pure antagonist is doing, it has blocked the thing. It is not giving any response, no, not potent, not efficacious. It is only blocking the site. ना खुद करना है ना करने देना. So no efficacy, no response. Here it comes. Full agonist, partial agonist, inactive compound in form of antagonist, or then inverse agonist. What is doing? It has affinity, but it is not giving the response which we want. Let's see. Let's talk about example. We are giving input in a thing which is not required, बल्कि उल्टा ही हिसाब हो जाता है. तो इसका ये है कि it has affinity, but intrinsic activity it is giving is not required. ठीक है जी. Receptors are present either in inactive or active form, but oscillating in an equilibrium state, already discussed with Dr. Fariha and Madam Sir. Let's see. Full agonist binds only to active form, so all the inactive form will be shifted to active form. And we can say that it is for maximum number of receptors are bound. So, of course, all the receptors have shifted to active form from inactive form. Then what happens? Partial agonist binds more to active than inactive form. इनएक्टिव फॉर्म भी है रिसेप्टर्स की, एक्टिव भी है, इसलिए हमारा थ्रेशोल्ड भी ज़्यादा था, हमारा जो मैक्सिमम इफेक्ट आया है वो भी कम है, पोटेंसी भी कम है. ठीक है, क्योंकि इनएक्टिव फॉर्म में अभी भी रिसेप्टर्स उधर है, उसने सिर्फ एक्टिव फॉर्म्स को किया है और हमें वो रिक्वायर्ड थेरेप्यूटिक इफेक्ट नहीं मिला इन टर्म्स ऑफ पोटेंसी एंड एफिकेसी. इनवर्स एगोनिस्ट ने क्या किया है, सिर्फ इनएक्टिव फॉर्म को जाके बाइंड कर लिया। अब यहाँ पे फर्क देखिए, फुल एगोनिस्ट क्या कर रहे हैं, एक्टिव फॉर्म को करता है, और जो इनएक्टिव रिसेप्टर्स होते हैं उनको एक्टिव में शिफ्ट करके उनके साथ हो जाता है। पार्शियल एगोनिस्ट क्या हो रहा है, एक्टिव फॉर्म को सिर्फ हो रहा है, मगर इन द सिस्टम दे आर इनएक्टिव receptors are present. But in case of inverse agonist, the drug is binding to inactive receptors. Active receptors वैसे ही है. So, whether the drug is inverse agonist or agonist, response मिल रहा है. चाहे desired मिल रहा है, चाहे negative मिल रहा है, चाहे positive मिल रहा है. Still, we are getting the response. But एंटेगोनिस्ट क्या है, बाइंड्स इक्वली टू बोथ फॉर्म्स, एक्टिव और इनएक्टिव को दोनों को कर रहा है, मगर रिस्पॉन्स नहीं दे रहा, जगह ही बंद कर दी, रास्ता ही बंद कर दिया, ना खुद करूंगा ना करने दूंगा. So what is it proving that there is no response, whether it is binding to resting state of receptors or activated state of receptors. So students, this was our today's lecture, and I know it was a bit difficult in terms of understanding receptors and all that, and it will of course take time, but still I tried my best. So this was our today's first part of dose response curves relationship. We'll continue the lecture tomorrow, inshallah ta'ala. And now it's time for today's assignment. Just write about graded dose response curve, its definition, and what information we get from graded dose response curves. Write definition of potency and write definition of max. Write definition of efficacy, potency. Write about KD and write about Emax and write about EC50. Chalo. Thank you, Ji. It was our today's assignment, and I hope I make myself very much clear with you people. In case if there are any questions, you are most welcome to ask me. Allah Hafiz.